China is planning to formulate or revise a total of 17 health-related laws in order to strengthen legal safeguards for public health. Shen Chunyao, who is the director of the Legislative Affairs Commission of the NPC Standing Committee, says the COVID-19 epidemic has exposed some problems in legislation. He also indicated the need for systematic law revisions and improvements. The legislation plan calls for efforts to formulate the biosecurity law and revise the law on animal epidemic prevention. CGTN's Wilkister Nyabwa spoke to Dr James Ogutu, the chairman of the Department of Medical Microbiology and Parasitology at the Kenyatta University School of Medicine, about the importance of legal frameworks in bolstering health systems.
Looking at the current scenario of COVID-19, there is so much need for effective healthcare systems globally, not just in China or in Africa. But when you look closely to the healthcare system in China, you will find that it is more well developed compared to the one in Africa. You would find that in China, you have a better specialist coverage of the healthcare systems. You would find that in China, you would have specialist hospitals, a cancer hospital, a women's hospital, a cardiovascular disease hospital, and so on and so forth. We may not have the same kind of structure in China, but I am aware that in China, the health system is very much citizen-oriented. If there is a health regulation or a health guideline in China, you would find that the implementation would be very strict. And that's adherence to regulations, guidelines, and laws would be very useful in at a time of a pandemic like today.
How crucial is legislation in terms of ensuring that everybody has access to proper healthcare services?
Legal frameworks will also highlight or would be able to anchor issues of indemnity when we come to the healthcare providers, the healthcare actors, the healthcare personnel, as well as will also highlight issues to do with insurance for the public. So it is very important that these legal frameworks are set in place to cater for extensive use of the healthcare resources and facilities. And of course, you would be very much interested to know that one of the problems that bedevil the low-income countries or countries in Africa and other parts of the world is the inability of efficiency in policy implementation. In other words, sometimes there is lack of political goodwill, or in certain cases, there would be corruption. This would be dealt with very clearly in a situation where there is a proper legal framework. The Chinese have done exemplary well in the face of the pandemic. And if in any case they have realized that there are some weak laws that they need to strengthen in order to be better for future purposes, I think that is commendable. And so African countries may also look into their laws and find where there are loopholes, so that when we are faced with such adversities and pandemics like the one we are in today, we can better address every problem that we face.